The lordotic chest x-ray, this is a special projection when the radiologist would like to see the apices of the lung without having the clavicles in the way of the upper lung area. So you're going to do this in an AP fashion. The patient's back will be against the board. I've got the filming crosswise to cover the width of the chest, and what I'm going to have David do is take one step out and then lean back so that the shoulders are touching up against the IR. Okay, now take a small step to the right. There you go, right there. So the patient is angled back so that the clavicles will be thrown up above the apices. So your central ray is going to hit midway between the jugular notch and the xiphoid. So I can actually come a little bit higher. Okay, and then I'm going to adjust my bookie tray to accommodate that. So again, place your marker on here. This is the left side. So this is our lordotic chest. Some doctors request a special projection of the chest by doing obliques. So I'm going to show you a left oblique of the lung. Again, this is a special request. It's not normally in the routine. So I'm going to turn David about 45 degrees. And what you want to check regarding chest x-ray obliques is that you want the light field to include both of the lungs. So look at the patient. Here's the midpoint. Central ray is going to be cutting through the upside. When you look, I'm going to put his hands on his hips just so that you can see the light field. You can see it beyond this left border of the chest, and you can see the light field go beyond the right border of the chest. So you want to double check and make sure that it does traverse across the chest area. You also want to check, you see light field 1.5 inches to 2 inches above the relaxed shoulders. So with your chest oblique, being this is the left oblique, you're going to use your left marker to mark the side touching. You're going to ask the patient also to do this on deep inspiration. So again, we're going to ask them to take in 2 deep breaths and then hold that. For the right oblique, have your patient 45 degrees. Right side is touching. We're going to place our right marker up against here. Okay, and then I'm going to readjust, lean David just a little bit forward so that we can make sure that we are getting both sides of the lungs on. So you want to check your light field, and it's going to look like this longitudinal light is on the upside from the midpoint of the chest. But it's real important we do include both lungs on this. So AP oblique is the more common oblique you'll be seeing. Now, it is okay to be imaging chest obliques in a PA oblique fashion. Thing to remember, just like with the rib x-ray, you're going to be marking the upside, because the upside is the lung field that you will be seeing best when you do a PA oblique. It's totally opposite than that AP oblique. So here David is in an RAO. I'm going to bring this arm up, bring this arm out. Okay, and then we're checking our central ray. It's going to be halfway between the spine and the lateral border, and we are including both sides, as you see here. Okay, but this is going to demonstrate that left lung the best. Okay, if we want to demonstrate the right lung the best, then we would do an LAO. David's 45 degrees. Okay, and you want to check halfway in between here, but make sure your light field cuts across both edges. It's important to compare both sides. Okay, so this is our PA oblique for the chest.